go ahead. You can read that.
Hello, my name is Patrick Christos Salamita. I give Olivia Cheesen permission to video this health assessment for educational purposes.
Thank you, and I can take that. Okay, so first I introduce myself. Hi, my name's Olivia. I'm gonna be your student nurse for the day, and I'm gonna be performing your respiratory assessment. So I'm gonna start by performing proper hand hygiene, and I would put on my gloves. So pretend I'm putting on my gloves, alrighty. And then after I've done that, I'm gonna ensure privacy for the patient, and then I'm going to identify the patient. So can you tell me your name and date of birth, please?
Patrick Salamita, 8/30/97.
All right, so I've identified the patient. Next, I'm gonna check for orientation status. So you've already told me your name. Where are you?
I'm in your apartment.
What day of the week is it?
It's Friday,
And why are you here?
so that you can do this assessment.
Okay, so patient is oriented times 4 because he's oriented to time, place, person, and situation. So I will note that. Next, I'm going to note the patient's mood. Patient's mood is pleasant. And on a scale of 0 to 10, with 0 being no pain and 10 being the most pain imaginable, how would you rate your pain today?
0.
Okay, so that is noted. After I've done that, I'm going to ask the patient if they use any mobility aids such as wheelchairs, crutches, walkers, or if they have any medical equipment such as IVs, oxygen, specialized mattress, if they use any SCDs, if they have any ostomies or dressings.
Nope.
Alrighty, so then next I would take the patient's vitals. In this case, I'm not gonna take them. I'm just going to read the proper ranges, or normal ranges. So, normal blood pressure is 90/60 to 120/80. Normal pulse is 60 to 100 beats per minute. Normal respirations are 12 to 20 breaths per minute. Normal temperature is 98.6 to 100.4. And normal pulse ox is 95 to 100%. So then that would complete my general assessment, and then I would begin the respiratory assessment, and I'm gonna do that by first, I'm going to assess the patient's breathing pattern. So I'm looking at rate, rhythm, if there's any use of accessory muscles, and if it's labored or unlabored. So just breathe normally for me. Okay. Okay, so rate is normal, rhythm is regular. There is no use of accessory muscles like the neck when trying to take breaths, and it is unlabored, which is good. So then after I do that, I'm going to look at the patient's nails, please, for clubbing, which is a sign of long-term oxygen deprivation. So that's when the nails become, the fingertips become enlarged, which there is no clubbing. And then I'm also gonna look at the patient's posture, which looks good, and just breathe normally. So when I'm doing this, I'm making sure that the patient is not in a tripod position, which also often happens when someone is in respiratory distress, which patient posture is upright, normal, so that looks good. So then after I've done that, I'm gonna ask the patient about any history of surgeries, traumas, any asthma, smoking, or anything that might affect your respirations.
I used to smoke a Juul.
Okay, so that will be noted in my chart. So then after I've asked about history, I am going to oh yes, thank you. I'm going to inspect the chest, the thorax for chest configuration and symmetry. So I'm looking to see if the diameter is normal. So normally the diameter, so it's 2 times as wide as it is deep. Sometimes patients who have respiratory disease will have a barrel-shaped chest, which means the anterior to posterior diameter is increased. So I'm just gonna be looking for that. Okay, so chest configuration is normal, it's symmetrical, and there is no barrel shape to the thorax, so that is good. And then after I've done that, I am going to palpate, which means I'm going to feel with my hands, both anteriorly and posteriorly, and I'm gonna be feeling for masses and any tenderness, and I'm also gonna be checking for any bony deformities. So just let me know if there's any tenderness, and I'm gonna be doing this in a circular motion. Any tenderness at all?
Nope.
Can I have you move this? Thank you. Any tenderness?
Negative.
Okay, can I have you turn around for me? So now I'm gonna do the same thing. And feeling for masses. Any tenderness?
No, ma'am.
Okay, so no masses or tenderness noted. You can turn back around for me. Thank you. So then after I do that, I'm going to percuss in the same spots. And so I'm going to use 2 fingers from each hand, and I'm going to be listening for resonant sounds, which is a hollow drum-like sound. Move this, please. Okay, I'm going to have you turn around. I'm going to do the same thing on the back. Okay, awesome. So resonant sounds were heard in all areas. So then next I'm going to auscultate, which means I'm going to listen with my stethoscope, and I'm going to be listening for adventitious sounds, which could be crackles or rails, which sound like a popping sound, kind of like wood in a fireplace. And that happens if there's mucus or fluid in an airway as air is trying to pass through. So it usually kind of has a moist sound to it. I'm listening for rhonchi, which is more coarse, and that's if there's any obstructions or secretions in an airway as air is trying to pass through. I'm listening for wheezing, which is more like a whistling sound, and it's continuous, and that happens if there is an obstruction in an airway. And then I'm also listening for pleural friction rubs, and that is if the pleural layer is inflamed, it would rub against the chest wall, and it kind of makes a scratching, coarse, creaking sound, and it's lower. So I'm going to be listening for any of those. So every time I move my stethoscope, could you please take a deep breath for me? And I'm just going to move this. Okay, can you turn around for me? All right, same thing. Every time I move my stethoscope, take a deep breath. Okay, awesome. You can stay like that. So respirations sound good. There was no adventitious sound, so that sounds great. Last, I'm going to check chest expansion. So I'm going to use my hands and place them on the back, and I'm just going to feel the rib cage as, yes, thank you. I want you to cross your arms, and so that it can spread the scapulae, and so I can better feel the rib cage rise as he inhales. So breathe in for me. Okay, thank you. So that chest expansion is equal bilaterally because my hands both rose and my thumbs moved at the same time. So that looks great, and that completes my assessment. Thank you.